initial is 1 and lodging in to start. So now we will start the study of the bone. And in case of adult human, the total number of bones are only 2, 0 and 6. So this is the total number of bones. Now these bones are divided into two parts. First of all, one is axial skeleton and one is appendicular skeleton. Now in case of axial skeleton, there are 8 bones. And axial skeleton includes the skull bone, the spine or vertebra, the ribs, sternum or breastbone. This bone comes under the sternum, axial skeleton. And in the appendicular skeleton, the shoulder girdle, the upper limb, the pelvic girdle, and the lower limb. These 4 types of bone constitute the appendicular skeleton, and these 4 types of bones constitute the axial skeleton. Now, skull bones have 22 bones. Then the number of ear cells are 6. Then hyoid bone 1, and vertebral column is 26, and thoracic cage has 25. These bones constitute the total number of bones, that is 8. And in case of vertebral skeleton, shoulder girdle 4, upper extremity 60, pelvic girdle 2, and lower extremity 60. Total 126. Now discuss about these bones. So let us start. First of all, the skull. Skull has 22 bones, and in case of skull, this is skull or cranial bone, and these are facial bone. Now cranial bone total number is 8, and facial bone total number is 14. Now in case of cranial bone, first one is frontal. It is number 1. Parietal 2, temporal 2, occipital 1, sphenoid 1, ethmoid 1. And in case of frontal bone, before the bar, these are 2 numbers, but they are not completely formed. These are the frontal bones, and these are the temporal bones. And the frontal bones constitute slightly, and whenever the baby is coming out, the condition is look like this. There is a small gap. This is membranous structure. This is not completely ossified, and if you see a small baby, his or her head is not ossified properly. After nearly about 8 to 10 months, this part is ossified. Now, all the bones are frontal, parietal, temporal, occipital, sphenoid, ethmoid. 2 paired bones, parietal and temporal, and less, and the others are only 1 in number. Then the facial bones. First of all, maxilla, mandible, zygomatic, nasal, lacrimal, palatine, nasal, inferior nasal concha, and common. And in case of this, they are paired and unpaired. Facial paired bones. Your professor may ask you, what are the paired bones present in the facial bones? Then you have to answer the maxilla, then the zygomatic, then nasal, then lacrimal, and palatine, and inferior nasal concha. These are paired, but the unpaired facial bone is mandible and the bone. These are the unpaired. And the mandible is the most strongest facial to chew your food. Then we have completed the skull bone. There are 22 bones, 8 cranial bones, and 14 facial bones we have covered. Then come the ear ossicles. In case of ear, there are 3 bones. These are small bones, malleus, iliacus, stapes, 2 in number, because our ear is numbered in 2. So that's why one is right ear, one is left ear. That's why there are 2 in number, malleus 2, iliacus 2, and stapes 2. Then the hyoid bone is only 1 in number. Then the vertebral bone these are 26 in number. First of all, cervical 7, thoracic 12, then lumbar 5. Then the sacrum, it is high bone which is fused into 1, so we will count only 1. Then the coccyx, which is 4 in number, but it is fused to 1, that's why we will count only 1. And the total 1, 2, 5, 7 to 9 and 7, that is 26 total. And these are the vertebral bones or the vertebral column C7, T12, L5, S5, C4. These are the numbers you may remember. In the first case, there are 25 bones, there are 12 pairs of ribs. So 24 ribs and 1 sternum. And in case of sternum, you know that sternum has 3 parts. One is mammalian, one is body, and one is xiphoid process. And in between mammalian and body, there is presence of sternal angle, which has much and more clinical anatomy and clinical significances. You may know in the sternum video, which we have already uploaded in our channel. You can see that. So we have covered the axial skeleton, the 80 bones, the skull 22 bones, ear 6, hyoid 1, vertebral column 26, and thoracic cage 25. So these are the total axial skeleton bones. Then in case of appendicular skeleton, these are 126 bones, and first of all, shoulder girdle or pectoral girdle. These are 4 bones, and these are clavicle, which is also known as beauty bone. It is present 2 in number, and scapula, which is also present 2 in number. Then the upper extremity or upper limb, these have 60 bones. First of all, arm. This is known as arm, which part from the shoulder joint to the elbow joint. This part is known as arm, and in this arm there is presence of only 1 bone, that is humerus, and it is 2 in number because we have 2 hands. One is right hand, one is left hand. That's why it is 2 in number. Then forearm. Here we have 2 bones, lateral radius and medial ulna. Then in this hand we have carpal bones. Carpal bones are 16 in number, and these are wrist joint which form by the carpal bones. There are scaphoid, lorette, triquetral, pisiform, trapezium, trapezoid, trapezate, hamate. So these are all these bones are 2 in number, and together constitute the 16 bones, which constitute the carpal bones, 8 in each hand. Then the metacarpal bones, which are 5 in number in each hand, and if we have 2 hands, then we have 10 metacarpal bones in our whole body. Then phalanges, these are 28 bones together, and there are 3 parts in case of phalanges. If we take this as a hand, then this one is proximal, this one is medial or intermediate, this one is distal. So proximal is a 10 number, medial 8, and distal 10. Why the medial is 8? Why not it is 10? Because in the thumb you can see that there are only 2 bones, one is proximal, one is distal. There are no and any type of intermediate bone present. So that's why the medial bone or intermediate bone is only and only 8 in number. Then the pelvic girdle, which have only 2 bones, one that is hip bone, this is 2 in number. One is ilium, one is ischium, one is pubis. These are the parts of the hip bone. So there are 2 bones in pelvic girdle. There is 2 are hip bone. Then the lower limb or lower extremity, in case of thigh, our longest bone of the body, that is femur. This is 2 in number. Then the patella. This is also 2 in number. Patella is the sesamoid bone. And whenever you answer that patella is sesamoid bone, your professor may ask you name another bone which is known as also a sesamoid bone. You can answer them. Pisiform is also a sesamoid bone. So if we know that is patella and pisiform, these two bones are sesamoid type of bone. Then leg. There are 2 bones in tibia and 2 bones in fibula in each leg. Tibia is 1 and fibula is 1 in one leg, and tibia is 1 and fibula is 1 in another leg. Then foot. In case of foot, there are 14 tarsal bones or 7 pair of tarsal bones. The bones are calcaneus, talus, navicular, cuboid, medial, intermediate, and lateral cuneiform. These are the 7 bones. You may remember these bone names. These are important for fiber because all of us know this is important from the point of view of bone. So these are 14 number. Then metatarsal bone are 10 number. Then phalanges 28, set proximal 10, middle 8, and distal 10. So this is the all detailed picture about the basic or general anatomy of the bone. So if you have any doubt or any query related to these topics, you can ask in the comment section. And in the next video, we will try to cover all the joints that are present in our body. So if you want this video, you can ask in the comment section and raise some likes and shares. And thank you so much for watching the entire video. Do like, share, and subscribe to my channel.